What is black fungus, white fungus, and yellow fungus? All these diseases are fungal infections caused by fungi, mucormycetes, belonging to Mucorales family. Formally, all these infections are called mucormycosis. Once inhaled, the infection can affect the sinus cavities, lungs, and chest cavities of a patient. Where does this fungus comes from? These fungi are present almost everywhere. Soil, environment, decaying food, fruits and vegetables. Why has this fungus started infecting us now? Black and white fungus infections aren't new. There have been cases of such infections in past. This fungus is an opportunist, which normally is harmless to people with good immune system or immunity. But as soon as it comes in contact with a person with low immunity, it may likely cause the infection. Why it is attacking COVID-19 patients? As COVID-affected patients are low on immunity, and taking steroids as well, it is giving chance to this fungus to infect more and more people. Reasons for weak immune system? Overuse of steroids, like in case of COVID-19 treatment. Other immunosuppressive medication. Chemotherapy treatment for cancer. Diabetes. How this fungus enters the body? Through air. While breathing. Through food. While eating old, or decayed food. Through wounds. If wound comes in contact with the fungus. The most common is through air. Symptoms, for infection via nasal cavity. Toothache. Headache. Nasal, or sinus congestion. Black lesions on nasal bridge. Fever. Symptoms, for infections via lungs. Fever. Cough and vomiting. In severe cases, it might include bleeding. Chest pain. Shortness of breath. Symptoms, for infections via skin. Can look like blisters or ulcers, and the infected area may turn black. Symptoms, for infection via stomach. Abdominal pain. Nausea, and vomiting. Gastrointestinal bleeding. The diagnosis can be done through biopsy, X-ray, and CT scan. The treatment procedures that are being followed today are antifungal medicines like amphotericin B, or in severe cases, surgery, to remove infected tissue from the body. Following precautions can be taken to prevent yourself from causing this fungal infection. Avoid inappropriate usage of steroids. Keep a tight control on sugar levels if you are a diabetic. Avoid overusage of antibiotics, as it may increase the risk of fungal infection. Avoid overuse of zinc supplements, as fungi thrive in zinc-rich environment. Avoid excessive steam inhalation. And try to keep your surroundings clean. Key points to understand what these infections actually are. All three black fungus, white fungus, and yellow fungus are fungal infections. So far, all of these are non-contagious. Causes of infections for all three are similar. But the symptoms, and the organ affected varies. The names does not signify their color. The names are based as per the symptoms they show. Like in case of black fungus, you see black patches near nasal cavity, and eyes. In case of white fungus, the tongue turns white, or white patches are found in oral cavity, or food pipe. In case of yellow fungus, as it begins internally, there is no visible symptoms, making it most fatal, out of all three. Lethargy, loss of appetite, weight loss, and in severe cases pus leakage, sunken eyes, organ failure, are some of its adverse effects. So, to keep yourself safe from getting infected, here are the 5 major takeaways for you. Keep your immune system strong. Take proper care of any pre-existing medical condition. Excess of anything is not good, so avoid overuse of steroids, antibiotics, zinc supplements, and steam inhalation. Eat fresh and healthy. Maintain hygiene and keep your surroundings clean. This information is designed to make you understand and keep you cautious about these fungal infections. Help us share this information to everyone. Be safe and keep safe.